In this study, we looked at learning and memory impairment in lupus patients using diffusion tensor imaging. This study is a result of a collaboration between the Department of Rheumatology and the Center for Functional Brain Imaging in Tel Aviv Medical Center in Israel. Memory impairment is prevalent in lupus, however, the pathogenesis is still unclear. In a previous functional MRI study, we demonstrated altered brain activity dynamics in patients with lupus without neuropsychiatric involvement when performing a learning and memory task. These maps show brain activity dynamics in lupus patients as compared to healthy controls. Learning-associated decrease in brain activity is shown in blue, and learning-associated increase in brain activity is shown in red. The decrease in activity in blue occurs in a network termed the default mode network, which is a set of brain regions which is active during wakeful rest and undergoes deactivation when performing a task. Lupus patients showed less deactivation when performing a task, and this was most prominent in the area of the anterior medial prefrontal cortex. In addition to failing to deactivate this network, lupus patients showed increased activation in another network, the task-positive network, as shown in red. We also looked at functional connectivity of the hippocampus. We chose to look at the hippocampus due to its central role in memory, as well as its role in the default mode network. When comparing lupus patients to controls, we saw more widespread functional connectivity, and when directly comparing these groups, as seen on the right-hand side, the difference was statistically significant, shown in pink. We concluded that increased brain activation in both networks, with less deactivation in the anterior medial prefrontal cortex, as well as more widespread hippocampal functional connectivity, may be due to compensatory mechanisms used to overcome memory impairment. The aim of the present study was to search for a structural substrate for this abnormal recruitment pattern observed in functional MRI using diffusion tensor imaging. This technique measures water diffusion through cellular compartments. Water diffusion in white matter moves anisotropically, meaning preferentially along the length of the axon due to highly structured axonal membranes in their myelin sheaths. This technique offers increased resolution compared to conventional structural MRI regarding white matter microstructure. When constructing DTI maps, we can look at two parameters of water diffusion. We can look at the magnitude of diffusion depicted by the apparent diffusion coefficient, or ADC, and we can look at the direction of diffusivity either in the minor axis depicted as DR or in the principal axis depicted as DA. Higher ADCs, meaning higher diffusivity, reflects tissue disorganization. Higher DI reflects decreased myelin integrity, and higher DA reflects decreased axonal integrity. Tensor information in each voxel can also be used to reconstruct white matter connectivity of the brain, termed fiber tractography. For this study, we characterized and compared brain diffusivity in 10 lupus patients without neuropsychiatric involvement and compared them to 9 healthy controls matched for age and education as shown here. These were relatively young patients with a mean age of 31. The mean disease duration was 11 years, median SLEDAI was 4, and median SLIC was 1. 7 of the 10 patients had a history of lupus nephritis, however, only 1 had active disease at the time of the study. The mean prednisone dose was 8 milligrams. 5 of the 10 patients had antiphospholipid antibodies, 2 of whom had the antiphospholipid syndrome, 1 with a history of renal vein thrombosis and the other with a history of splenic infarcts. We examined 2 tracks of the default mode network I mentioned previously. We looked at the corpus callosum and at the cingulum bundle using the DTI sequence. The cingulum bundle is a bundle of white matter fibers running within the cingulate gyrus around the corpus callosum, and it connects parts of the default mode network, including the medial prefrontal cortex I mentioned previously. And these are the results. In the left cingulum fibers, we saw significantly higher apparent diffusion coefficients and higher radial diffusivity values in lupus patients as compared to healthy controls. On the right-hand side, you can see reconstruction of the cingulum bundles using the DTI fiber tractography. In the corpus callosum, we also saw significantly higher apparent diffusion coefficients, significantly higher radial diffusivity and axial diffusivity in lupus patients as compared to healthy controls. Again, on the right-hand side, you can see reconstruction of the corpus callosum white matter tracts using DTI. These higher diffusion coefficients in the corpus callosum and left cingulum in patients with lupus may indicate impaired organization and reduced integrity of these tracts, and this may underlie the abnormal pattern of brain activity dynamics in the default mode network we observed during the functional MRI studies. These abnormal findings in the left cingulum were also in line with the central lobe of the left hippocampus in verbal memory, and the reduced integrity of the corpus callosum and cingulum are in line with previous reports of a hippocampal atrophy in lupus patients. This reduced white matter integrity may be secondary to autoantibody-mediated neuronal damage as suggested by other workers. In conclusion, impaired organization and reduced integrity of white matter fibers connecting the default mode network may underlie memory impairment in lupus patients. However, this was a small study, and we need larger studies to better characterize this structural impairment and to better underlie its pathogenesis, including the possible role of disease activity, damage accrual, medication, and various autoantibodies mediating neuronal damage. I'd like to thank my colleagues at the Department of Rheumatology and at the Functional Brain Center, as well as the patients without whom this study would not be possible. Thank you for your attention.
Thank you very much. This paper is now open for questions.
I have a question. Did you consider also including patients with neuropsychiatric lupus as well as patients with fibromyalgia and lupus?
Well, this was a small study, and we chose specifically to look at patients with that neuropsychiatric involvement because we were intrigued with our previous study where we saw memory impairment in patients who didn't even complain of memory impairment. And again, this is what we see here. We usually look at patients with neuropsychiatric lupus and expect to find these findings, but these were young patients that have no complaints and no neuropsychiatric involvement, and we feel that this might be significant.
Dr. Alarcon?
Are your findings consistent with what you see in patients that don't have lupus but have really memory loss? Is this what has been described?
Could you repeat that? It's similar to patients who have memory impairment?
Yeah, but do not have lupus. You know, are these the typical changes of a patient with impaired cognition?
Well, I can comment on our previous study using neuropsychiatric tests where we saw that lupus patients showed memory impairment which was similar to patients with frontal brain damage, and we actually predicted that we might find impairment in the frontal lobe, and we did. So this is similar to people with frontal lobe damage, yes.
I had two questions. One, did the DTI data correlate with the functional MRI data? Were these the same patients? And was there a correlation between the two?
These were the same patients, but we looked at them as a group, and we didn't look at each patient specifically because it is very difficult to dissect the data for each patient, but we looked at a group, and these are the same patients. And what we actually tried to do is see if these white matter tracts that connect the areas that in the default mode network that are impaired are also impaired, and they are.
And the second question, you mentioned that 5 patients were APL positive and 2 were APLS. Is it possible that at least some of the abnormalities would have been subclinical MRI infarctions, or did all of these patients had normal MRIs as well?
Thank you for your question. All these patients had completely normal structural MRIs. We do know that persistent antiphospholipid antibody positivity is correlated with cognitive dysfunction. This study was too small to dissect the relative role of these antiphospholipid antibodies, and we're planning a larger study to look at that.
I would like to know if you can associate another autoantibodies to your study, the frequency of other autoantibodies, because, for example, anti-ribosomal P and other autoantibodies in your study. You have something to tell us?
I completely agree with you. We do want to look at these possibly pathogenic autoantibodies, but this was too small a study to look at that, and we are enlarging the study now and trying to correlate these possibly pathogenic autoantibodies with our findings.
Thank you.
Thank you very much.